Thank you. Thank you very much for having me. It's quite an honor to be here. It's a beautiful country. My first time visiting here. What I'm going to share with you today is talking more about advanced intraoperative imaging to maximize your diagnostic yield. And so the problems we currently have with navigational bronchoscopy, a lot of this has been spoken about yesterday, I noticed in a lot of the lectures, and probably a lot in various sessions today. But the problems that we currently have is that we have issues with CT to body divergence. So we have an inability to reach the target that we need to get to accurately. And so the challenges of virtual navigation is that green ball or that yellow ball or that blue ball that we're all chasing when we're doing our procedure really the lesion that we're trying to go over? And what we know is that CT to body divergence occurs with every platform that we have. So real-time imaging is critical for us to be able to get a diagnostic yield. We know that our interventional radiologists do a great job. Why do they do a good job? Because they get that tool and lesion confirmation. They get a greater than 90% diagnostic yield because they put their needle in, they see their needle in the lesion every single time. They know that they're in that lesion, they have that confirmation. And so I'm going to focus on body vision for a little bit because I think it's the one that's most cost effective for those of you out here in Asia, and talk about the intraoperative image that you get with this particular platform. So what this platform does, it allows you to eliminate CT to body divergence by giving you that visual confirmation tool and lesion with the current fluoroscopy machine that you have. You don't have to go out and buy new machines. You don't have to go out and get mobile cone beam. You don't need to get into your IR suites. It's whatever fluoroscopy machine you currently have in your bronch suite. The system consists of a tablet. That tablet is wireless. It can go anywhere in the room. The patient lays on a board. There's a bunch of beads. It's not electromagnetic. Those beads are simply there so that in real time, you know where you are in relation to the beads, anatomic structures. And here you can see AI Tomo. You can see how nice your images are, and you're able to actually see your nodules. You can see ground glass lesions with this, smaller nodules, larger lesions as well. And so this is intraoperative 3D imaging versus a cone beam CT. So here's your Philips cone beam CT image here that you see on the right. And here's a body vision image, same patient, same lesion that you're seeing. And you can see the imaging between the two. So the benefits of this is lower radiation, right? If you're doing less of a sweep, you're getting lower radiation exposure. You don't need to leave the room. It can be used in your bronchoscopy suite, like I said, and less expensive than a lot of these cone beam machines that are out there. This is intraoperative CT imaging versus your mobile cone beam machines now. So this was in my bronch suite that we looked at. You can see at the top is body vision again, same patient, same lesion, versus the CEOS imaging that you're having. So I have both a GE 9900 and I also have the CEOS. We brought them both in to get imaging on the same patient to see what it looked like. So again, with the mobile cone beams, the same benefits I just showed you. So when you compare the two, the body vision versus getting your mobile cone beam machines, the biggest things here is obviously the cost, the radiation dose that you're having, and the augmented fluoroscopy to me is very important. That augmented fluoroscopy I want to spend a second on as well, because once you have it and once you've used it, it's something you don't ever want to give up in your bronch suite. The augmented fluoroscopy is where the nodule is in real time. It always stays up on your screen. You see it all the time. That nodule stays with you whether I put my fluoro machine into LAO or I put my machine into RAO. I am always going to see that yellow augmented fluoro on my screen at all times. Again, you get this nice tool and lesion confirmation here that you can see. And then you have this nice 3D view like you have down with your fancy cone beam machines down in IR where you can spin around. You can actually see where are you in relation to the nodule. Are you anterior? Are you posterior? And so in summary, intraoperative 3D imaging with any C-arm can have significant superior clinical outcomes. It can seamlessly get integrated with whatever it is that you have in your bronch suite now. It's very cost effective. And here I just put a little table that just kind of gives a summary of the difference between digital tomo and cone beam. Less radiation, cheaper, you get the augmented fluoro with the digital tomo, and you get tool and lesion with both of them. And so with that, I'd like to say thank you. I'd like to invite all of you to the US. I am the president-elect of the AVIP. We have our own national conference that's coming up in August, and I'd like to welcome all of you to Texas in August. I can guarantee the weather will probably be about the same as it is here, very hot and humid, but please join.